during Met Shining Vibe. Right now, we're gonna get into the topic during Met in Focus about breast care. Of course, today we have Dr. Satit, Srimontayamas, breast surgery and surgical oncologist, breast center, Bangkok Cancer Hospital. Wattanoson. He will be educating us and telling us all about breast cancer problem or anything that you would like to know. Not only that the doctor will be talking to us about breast cancer, but of course he has a free e-voucher for quadrivalent influenza vaccine, 2 prizes to be given away. So for those of you who are watching right now through Facebook Live, don't forget to share this live, set it to public, leave your comments, and then whichever questions that gets to be talked about during our Met Facebook Live will get this voucher for free.
Met in Focus.
I must say that breast cancer is the most common cause of death amongst Thai women, and the rate is increasing like really rapid. So it is really important to take care of yourself to lower the risk and prevent breast cancer. Today's topic that we will be discussing is breast care with the expert Dr. Dr. Satit, Srimontayamas, breast surgeries and surgical oncologist, breast cancer, Bangkok Cancer Hospital, Wattanoson. สวัสดีค่ะ
สวัสดีครับ Good morning คุณ Carla and good morning everyone.
Good morning. How are you?
Fine. How are you?
I'm great as well. Talking about breast care. This topic is I would say it's really common, and I mean looking into the infos of the death rates of women here in Thailand, it is quite rather really high when it comes to breast cancer. Apart from breast cancer, what are the common breast problems that we have?
Okay, there are many common problems of the breast that bring patient to the hospital.
Right.
The breast lump and breast pain are the most common problem. And other problems such as the nipple discharge, skin change, chronic ulcer at the skin or the nipple, skin breast deformity or something like that. So the breast lump and breast pain is one of the most problem that the patient come to see the hospital.
Right.
So the most breast cancer presented the breast mass, but fortunately most breast mass are not breast cancer. The breast mass may be the real mass or real tumor or the cyst, or it's only dense breast tissue, especially in young women that normally has dense breast tissue. So if you notice any lump in your breast, you should come to see the doctor. The doctor will do the physical examination and to do the mammogram and ultrasound to make sure that the mass is suspicious or not. If there is a suspicious mass, the doctor will advise you to do the needle biopsy to take the tissue from the mass to check. Yes, and the next problem is breast pain.
Right.
Breast pain is the most common problem that the patient concern, but pain is usually not related to the breast cancer. It may be from the hormonal change.
Okay.
Hormone is maybe related to the period.
Oh, right.
Yes.
Of course. That kind of pain. Okay.
Yes, if it's related to the period, it's called cyclical pain. Or it may be from other causes such as the muscle, the breast tissue, or the connective tissue inside the breast.
Right.
Yeah, it maybe occur any age, maybe occur in one side or both sides or any spot of the breast. Yeah, the breast pain, if the pain is persist more than 2 or 3 weeks, you should see the doctor. Yes, to make sure that there is no any problem. If the doctor check the pain is not have any problem, the patient can take the painkiller to avoid the hormonal use or to use the proper bra to avoid the tight bra. Yeah.
Right. So how do we get our breast tested. I mean, sometimes we have lumps and we don't feel the pain, and we don't go around trying to find that lumps every day.
Yes, I mentioned because the mass maybe the tumor, maybe the cyst, or maybe the dense breast tissue. So if it's from the cyst or maybe from the dense breast tissue, is maybe related to the hormonal change in the before or during the period, the breast will become dense and you may feel like a lump. Yeah, so if you don't sure what it is, you should see the doctor.
Okay, so how do we get checked with you guys? Whether like what are the procedures?
Okay, so you can check your breast by yourself at home. It's called breast self-examination.
Okay.
The proper time is 1 week after the period, because during the period the breast will become dense, so it may be difficult to palpate. So after 1 week, the breast will become soft, so it's easy to palpate. If there is any lump inside, okay, you may feel it, yes. And the breast self-examination, there are 2 parts. The first part is like an inspection. Inspection means looking your breast.
Okay.
To stand in front of the mirror, to put your hand on your waist and look at your breast. Yes, it should be symmetrical.
Okay.
To see the shapes, to see the skin. If there is some deformity or is some like a retraction, the color change, or there is any ulcer, that may be abnormality. So the second step, to lift your hand up and see your breast again. The breast should be moved up when
we raise
lift
our
your
hands
hand
up.
Yeah, but if it's fixed or if it doesn't move, okay, it maybe have some problem inside. And the second part, after inspection or looking your breast, you should lie down on the bed and use your right hand to check your left breast.
Okay.
Yes, and use your left hand to check your right breast. Check, start from the nipple. Gentle squeezing to see any discharge from the nipple. And so palpate from inner to outer. It may be like a circular motion, or maybe examine each sector or quadrant of the breast, or maybe exam for the inner up and down and go to the outer up and down.
Right.
And the last step, don't forget to check your armpit.
Armpit.
Yes. Is there any mass, any lymph node, any palpable mass? Yeah, this is the last step.
Okay.
For if you check and there is any abnormality, okay, you should go to see the doctor. And the normal women after 35 or 40 years old, you should see the doctor to do the breast examination by the doctor. That's called clinical breast examination. And mammogram and ultrasound every year.
Right.
Yeah, to check your breast.
It's like an annual checkup. When you go in
Yes,
for annual
like
checkup, then
yes.
you just ask for to check your breasts as well. Are there any updates on breast cancer nowadays?
For breast cancer treatment?
Yeah.
Right? So the breast cancer is the most common cancer in female worldwide and in Thailand. There are more than 20,000 new cases per year.
Wow, new cases.
And yes, the incidence is increasing every year.
Right.
Yes, although the incidence is very high, but the mortality rate or death rate is much better than other cancer.
Oh, really?
Yes. So, and the treatment of the breast cancer is not only one modality, not only surgery. The surgery is the main treatment of the breast cancer, but the additional treatments such as the chemotherapy, radiation, hormonal therapy or targeted therapy or immunotherapy are really, really important.
Okay.
In the past, when the patient have the breast cancer, he had to we cut her breast,
Right
whole breast
away.
out. But
Right.
nowadays we can preserve the breast. We can do the breast reconstruction.
Nice, nice. It also gives this,
Yeah.
I feel like a lot of women, when they say you have breast cancer and you think that, oh, you have to cut your breast out, it feels like you're losing a
Yes.
part of you. So this is, wow,
Yes,
this is
yeah.
major. This is really nice. Can you give health tips for metsters that are listening right now for when it comes to breast care?
Okay, for the breast care, because the breast cancer is we don't know what is the cause of the breast cancer, so the prevention is very difficult. Yeah, so early detection is really, really important. Yeah, so how to take care of your breast. So the first of all, I think the diet is very important.
Right.
Should eat the healthy diet. You should eat as normal, no any restriction, but not too much sugar, not too much fat.
Okay.
Eat more fruit and vegetables. And the second thing, you should control your body weight, because if your body weight is increased, if you have more fat in your body, the fat will be changed to estrogen hormone. The estrogen hormone is related to the breast cancer.
Oh, okay. I see.
So, yeah. So if you can control your body weight, it will be reduce the risk of the breast cancer. And next, to exercise regularly. You should exercise at least 30 minutes per day or at least 150 minutes per week.
Right.
Exercise can reduce the risk of breast cancer. To avoid the prolonged hormonal use. Hormonal use means the birth control pills or hormone replacement therapy for menopause.
Right.
You can use it for maybe for a while. 1 year, 2 years is okay. But if you have to use more than 5 to 10 years, okay, it may increase the risk of the breast cancer.
Right. So basically, just have a healthy lifestyle that can also not just prevent breast cancer, but everything else that comes after as well.
Yes. And you should check the breast regularly that I mentioned before. If you feel something wrong, you found the mass, okay, you should see the doctor. And you should ask your family member. You should see if you have the family member has breast cancer or ovarian cancer, you may have higher risk of the breast cancer than other people.
Okay, of course.
If you have more than one member, or
family.
if she has breast cancer at the younger age, less than 40 years old, your risk is higher.
Oh.
If you have a strong family history of the breast cancer or ovarian cancer, you should see the doctor or genetic doctor to discuss with him about the genetic testing, because now we know the genetic mutation for the breast cancer, that's called BRCA, BRCA1 and BRCA2. If you check the genetic testing and if you found it's abnormal or the genetic is abnormal, you should discuss with your doctor to how to prevent. You can take the medicine to reduce the risk, or you can have the operation to remove the whole breast and put the implant to make the breast reconstruction.
Right.
Yes, because now the breast reconstruction is very safe.
Okay. So
The
that's
quality of silicone is okay. It's very good. You don't need to change the silicone, the implant every 5 or 10 years as before. Yes.
Okay, we got a lot of information today. Thank you so much, Dr. Satit. But we will continue this on our Facebook Live. But for now, I'm going to have to say bye to you on air. But don't go anywhere. We're going to discuss more on this topic about breast care. ขอบคุณนะคะคุณหมอ
ครับ
เมส
Thank
เตอร์
you
คนไหนนะคะ
ครับ
ที่อยากจะถามคำถาม
สวัส
เพิ่
ดี
ม
ครั
เติม
บ
นะคะ for those of you who want to get to know anything breast related on how to take care of your breasts on this topic of breast care, tune in into our Facebook Live right now.
Met in focus.
Hello.
เสียงมันกระตุก
Hello. คุณหมอคะได้ยินไหมเอ่ย
ได้ยินคำเมื่อกี้เสียงมันกระตุก
Okay.
Sorry
All right.
ครับ
We will continue this topic on breast care on our Facebook live right now. You were mentioning on how to check our breasts, to examine our breasts by ourselves, right? Stand in front of the mirror, put your hand on your waist, put your hands up, lay down. Would it be harder if that women had breast implant?
Okay, it's not difficult for the women who have breast implant because the implant we put under the breast tissue. So the
okay.
breast tissue is in front of the implant. Yeah, so if there is the mass or anything at your breast, okay, you can feel it.
Oh, all right.
Yes.
Okay.
Yes.
So it's not
But
that
first time you do the breast examination, you may confuse about the there's breast tissue or the mass or the lump or some swelling. So if you do regularly every month you will know, okay, this is the normal for me. This is no mass. This is just only breast then tissue. Yes, just get familiar to your breast first. Yes.
So I've been hearing, I don't know if it's true, and I also want to know that sometimes when you wear your bra too tight all the time, like it might be bad for you. It might create lumps or anything. So is it true that when you choose your bra size, it should not be too tight? That you're maybe not you don't feel suffocated, but maybe your breast feels suffocated from that.
Yes, so I think there is few report to mention about this problem because they believe the too tight bra will like obstruct the lymphatic drainage of the breast. So the prolonged obstruction of lymphatic drainage of the breast may cause of the breast cancer, but now there is no any strong scientific evidence to support it. But if you can avoid the too tight bra, it may be better. You should wear the proper bra, not wear the tight bra. Yeah.
Right. So would you recommend for women to sleep with their bra on or sleep with their bra off at night?
I think for the bra, I think there is no any relation about the breast cancer. So I think if you feel comfortable to wear or to do not wear the bra, I think you can do it either.
Okay, so it has nothing to
Yes.
relate. Okay.
Yeah, but not too tight. I think maybe the point.
Okay, so you were saying that really control what you eat. So what are some kind of food that if you overeat it or if you eat them too much, it can cause cancer?
Okay, so for the food, I think the food is not the strong risk factor of the breast cancer, but it may be related to the increasing of your body weight. So too much fat, too much sugar may cause you get fat, and it may be related to the breast cancer in the future. So you should control like a fat, sugar, and eat more fruit and vegetables.
Do we have we have questions coming in. Okay, Kun Tang was asking, we have questions from our listener who said, is it true that no bra is more risk, not wearing a bra?
No.
No, because I just asked the doctor
Yes.
similar question too, that should we sleep with bra ons or bra offs? There are no scientific backup on this, really, that it has something to do with breast cancer or whatnot. So whatever you feel comfortable with, that's more like it.
Yes.
Right. And I would like to know that, let's say we have a woman coming in and you say and she has her breast removed for her own personal likes. That person, that woman does not have breasts anymore. Is she also prone to get breast cancer? But she removed her breast. Do you know what I mean?
You mean if you remove the whole breast?
Yeah. Let's say a woman maybe wants to. She doesn't want to be a woman anymore, and she wants to remove her breast out. But she's also still a woman. Is she prone to get breast cancer as well?
If she remove the whole breast, both sides, yes, the list of the breast cancer is will be very, very low because no any breast tissue anymore. Yes, she has only the nipple and the tissue under the nipple, so the list is become maybe 1 or 2%. Only that, yes.
Very, very low. Okay.
Yes.
So going back to genetics, let's say if my mom or my grandmother has breast cancer, am I more likely to get it, or do we need to get tested?
Yes, that is the criteria to consider who is high risk or who is low risk. Yes, that I mentioned first. How many family members had breast cancer? If more than one, the risk is higher. That family member is your first degree relative or second degree or third degree. If she is the third degree, like a grandma or aunt or far from you, the risk is low. But if she is your mother, your sister, your daughter, the risk is higher. If she has the breast cancer at younger age, 30 years old, 25 years old, or less than 40 years old, your risk is higher as well. If you are more than one person, 2 or 3 or 4, your risk is higher as well.
So what would you say?
Yeah, so the doctor will will consider how many criteria, how many risk factor you have, and they will advise you to check the genetic testing.
So at what age do you think that we should start getting tested to check for breast cancer? At what age?
Even any women or who have the high risk?
Just any woman in general, because we have to do health checkup regularly, like once a year. But when do we start to check for breast cancer?
For the breast cancer, the women should start to check the breast after 35 years old.
After 35.
And mammogram and ultrasound should be done after 45 or 40 years old. For the guideline, international guidelines suggest to check after 40 years old. Mammogram and ultrasound every 1 or 2 years. Yes, but in Thai women and in Asia, the incidence of the breast cancer is younger than Western people.
Oh, okay.
So some guideline in Thailand suggest to start to exam after 35 years old.
All right. Before we leave today, doctor, is there anything you'd like to give advice or leave for our metsters if they have worries about breast cancer?
Okay, that I told you. The cause of the breast cancer is unknown, so the prevention is very difficult. So early detection is very important, because if you found in early stage breast cancer or at the beginning of the breast cancer, the treatment is easier. The recovery is faster. The side effect is low. Yeah. So how to avoid or how to reduce your risk of the breast cancer? To reduce your risk factor, to do the early detection breast cancer screening. Yes, and don't forget to check your breast regularly.
All right, thank you so much, Doctor, for your time today to discuss about breast care topic with our listeners today. Thank you so much นะคะ
Thank you so much
ค่ะ
สวัสดีครับ
ค่ะ and that is Dr. Satit Srimontayamas, breast surgeries and surgical oncologist, breast cancer, Bangkok Cancer Hospital, Wattano Sot. For those of you who wants to get consultation, you can also contact our doctor. But for now, I'm gonna have to say bye to you. Thank you so much for tuning in to Met in Focus with me next Friday or next week. What topic we will be focusing? Do stay tuned. Thank you so much for tuning in. See you next time. Bye bye.